Hello, my name's Cathy Head. I'm a consultant cardiologist at the Norfolk and Norwich University Hospital. I specialise in adult congenital heart disease and heart disease in pregnancy, and it's about this that I'd like to talk to you today about some of my experience during COVID-19. I'm the president of the UK Maternal Cardiology Society, which is a new multi-professional group formed in November last year with the aim to advance the care of women with heart disease in pregnancy through research, service development, education and external engagement with other bodies such as the ESC. This year in March, it became clear that we were well placed, having formalised this previously informal network of cardiologists and obstetricians and anaesthetists working in this field, when the government announced that women with significant heart disease in pregnancy should be shielding during COVID-19. Clearly it was important to help determine which women had significant heart disease and which didn't, and therefore who should receive the shielding advice. We were able to produce a document which was published as a statement with the BCS, and you'll find that on the COVID-19 Information Hub. And that document was able to go out with the NHS England letter to all hospitals to give guidance as to which women should be shielding and which shouldn't. In terms of my own practice, things have obviously been very different. We've been fortunate here in that we've had the availability of outpatient facilities at the neighbouring private hospital so that we can still do face-to-face outpatients with patients who need this, and we've continued a monthly cardiac obstetric face-to-face clinic for these women who need to be seen in person, and also had the facility to do non-invasive investigations such as ECG and echo. The rest of the appointments have been on the telephone, which I found has worked well for pre-pregnancy counselling in women who've already had their investigations and for symptomatic follow-up. It's been important, obviously, that we've been able to continue some kind of face-to-face follow-up, as pregnancy tends to be somewhat time limited and isn't something that you can put on a waiting list. In terms of where we go from now, the educational sessions that we were planning to deliver at the BCS meeting will now be delivered as a webinar series. And we also, obviously in due course in the future, have plans for further face-to-face meetings when that can occur. We've got ongoing research projects, we've got ongoing guideline development, and ultimately we'd like to be able to facilitate some reflection on all the rapid and significant change that's happened over the last few months, and how we can take forward all the good practice from that and go back to a better normal rather than the previous normal. So thank you for listening. I hope that we might be able to meet face to face again at a BCS meeting at some point in the future.